Gatto. Thanks for watching the Hellstorm. Today I have an incredible guest, Sheila Savageau. She is really a treasure. She has done 20 years working in health benefits and HR. She currently is the U.S. healthcare leader for General Motors. So she's in charge of all the healthcare for GM. It's really a good show. We dig into a lot of issues. GM, of course, is a huge company, lots of workers, and really at the forefront of employers taking initiative and trying to drive change in the healthcare system. Please watch the show. Really enjoy it. I enjoy doing it. I think you'll enjoy watching it. Thanks a lot. Okay, welcome to the Hellstorm. I have a great guest today, Sheila Savageau. She runs all of U.S. healthcare for General Motors. Obviously, a huge job, lots of employees. Sheila, tell the audience sort of a little bit about your background. You know, what you did before GM and then your role at GM.
Wonderful. Well, Vic, thank you so much. And a little bit about my background. I have over 20 years of experience in benefits, and it's broad-based benefits, both domestic and international. I've been with GM for 6 years now. Started at GM as the International Benefits Director, again, looking across the entire benefits spectrum for strategy. And then since 2017, I've been leading the U.S. healthcare space for General Motors. Prior to that, I spent over 9 years at Ingersoll Rand, was mainly involved again with benefits completely across the spectrum, both in operations and strategy, and domestic and international. And I think I've had a great opportunity working in global companies and just in very many different facets, seen a lot of the world, and really gives me a lot of momentum for my position today.
Yeah, excellent. So talk about benefits and the talent and HR at GM. I mean, I think every company today, the people are really what drive the value, and benefits are a huge piece of that. How do you think about that at GM?
Yeah, I mean, the way that I look at General Motors, we are very, very blessed to have some incredible talent. Whether it's in the talent organization, whether it's in the HR business partner community, specifically in benefit, and then our operation partners that make it all happen. I think we have a broad, diverse background across those functions. We have a lot of global expertise that's brought to the table. We also have a GM Health Services team. So from a clinical perspective, they are very well versed in everything, and just bringing them to the table and partnering with the right people when we think about strategy and benefits. So great, what I call collaborative group of people that really brings everything together from a strategic vision standpoint.
Yeah, so talk about the size and influence and scale, really global scale of GM, and then your influence on policy and kind of health direction and benefits direction.
Yeah, so globally, GM has over 180,000 employees. Within the US alone, we're at 90,000 employees, but you add dependents on that mix, and we're quickly up to 180,000 that are eligible for some type of health care. When I take a look at GM and just being, in the Fortune 10, I've got to tell you, I think that we are definitely in a great position to get attention, not only of other employers, but also suppliers as well. I find that we are really on the forefront of trying to change the way that healthcare is delivered in this country. And, I take a look at my position, and just when it comes to Capitol Hill and the policy that's being driven, really helping, our congressmen and women understand the decisions that they're making and like how those are impacting specifically Americans in this country who actually have coverage under employer-sponsored health plans. And not only that, but I think really collaborating with other employers to understand their position as well. Employers similar in size to GM, and then those that are not similar in size, but how can we also help them at the same time for the common cause to really improve healthcare delivery in this country?
Yeah, so it's interesting that you go to the educational side, like whether you are educating our politicians, or you're educating your coworkers in the benefits group, or you're educating line workers or professional staff at GM. sort of teaching people is the first step to influencing their behavior, right? Whether it's to maybe eat healthier or to vote on in the way that is better for our country. I think that it really is interesting that you sort of focus on education first, and then you sort of help them come to the right decision. Is that fair?
I would say that's fair. And, the way that I look at it, I think there's a teaching or an educational component, but I think there's also a marketing component. I think about myself as a consumer, and I think about healthcare and how difficult and complicated we've made healthcare in this country. It really doesn't have to be difficult and complicated. If we think about every individual as a consumer of healthcare, how should I market to that individual? What should I tell that person? How should I teach that person? And so it's no different than you and I being solicited through social media or being solicited, through our home mail. What's the right avenue to really drive us to a particular brand or a particular education component? So when it comes to all those categories that you just mentioned, Vic, that's how I think about it, is really, as a consumer, what should I know and why is it important to me and my family?
Yeah, and I've used I got to be careful now because I'm with GM, but I've used the car buying process as an analogy for the right way to help consumers navigate a really complicated and it's a financially important decision of what car do I move into. There's lots of choice. There's lots of things to consider, both immediate and over the future. And GM and others have really worked hard to create brand and education and feature sets to help people navigate that. In healthcare, maybe it's slightly more complex, but it's not that much more complex. And we just have to try to package it and market to people.
Yeah, I think that's true. And I think, when I think about it from a policy perspective, there's some things that I think have to come into play. And it's what is truth in pricing, right? Like, how do I know if I'm going to go for a procedure, what that procedure costs depending on where I go? And that should be readily available to me. If I'm taking a pharmacy, if I go to one pharmacy versus another, I should truly know the cost of the drug. And not just the cost, and then you have the complicated game of rebates and other things, but what is the true transparent cost that both I'm going to pay as well as my company is going to pay? And knowing, is that reasonable or is it not reasonable? And really, based on all the information provided to you, being able to make an educated consumer decision.
Yeah, yeah, and I think politicians and others will say it's complicated, so let's just not try. And I think that's not enough anymore. Lots of things are complicated, and we package them and try to make them presented in a way that consumers can understand, because it's really important to get the message across. I think healthcare is the same.
I would agree, and I think the other component of healthcare that we've got to get what I call some common factors around is definitely the quality. When I think about quality, I think about safety. I think about, if I'm going in for a type of treatment, even if it's a knee replacement, if it's a hip replacement, if I'm going in for cancer treatment, depending on what type of cancer, I want to make sure that I'm going to a place that has the best quality so I can have the best outcome possible. And again, the way that I look at it, you have so many consumer tools out there today that are readily available on the market, even outside of healthcare, that can tell me, is it, a 5-star rating? Is it a 4-star rating? And really helping, again, put that information in the consumer's hands to make the best decision that they can make, because we're all looking for the same thing. When I take a look at healthcare, I think about my family. Where would I want my family to go based upon what's wrong with them? How can I have a reasonable price that I should be paying? And at the same time, how can I ensure that their quality of life is going to get better after that procedure not worse?
Right.
And so the quality play comes in, tremendously.
Yeah. Okay. So then I want you to talk about GM's role in grouping up with other large employers to learn from each other and also to influence change. I'm not sure many of the audience would know about the Business Group on Health, and GM really has been a leader in that initiative. Talk about how that works, just roughly. You don't need to name them all, but who are the players in it, and how does GM lead that bigger group?
Yeah, so Business Group on Health, I would tell you GM is intimately involved. I mean, we do have a position on the board. We head up and we either head up or we reside on many of what I call the founding committees. And what I would tell you that I think Business Group does really, really well, they bring together about 400 pretty sizable employers that really focus on what I call the importance of, what do the employers want to see? And I'll just give you some examples.
And it's 400 of the like the Fortune 1000 or even bigger. I mean, it's all the big, really big. I mean, there's some small ones, but it's a significant body of employers.
It is. It is. And the value that I see in Business Group on Health, there's multiple facets. But even when we started looking at value-based initiatives, we went, okay, guys, we can drive this all day as an employer, but we really do need a committee put together that, one, we can kind of create what does it look like? If I'm looking at a maturity model around value-based care and I'm looking at a system or a provider system or how I'm planning to deliver that, what as an employer should I be looking at? And I look at the value behind that one. And not only did we bring employers together, but we brought health systems together at the table.
Yeah. And really try to collaborate. Well, let's get to
absolutely.
How do we define these things? What is important to all sides
Yes.
so that you can create a win-win situation? Win-win.
Well, and I think as things evolve, right? So it's not just about setting them up, but going on as things evolve, what works, what doesn't work. And I would tell you for the first time, even in that committee by itself, Vic, what I found myself doing, and it was really interesting because we had, we had insurers at the table, we had the health systems, and we had employers. And what was really interesting is it was fascinating to hear the health systems and the employers exchange. And I think we got so much value out of it because, for years they haven't heard our voice at the table.
You're just in silos, like talking to each other, and you don't appreciate the struggles and the challenges from the other side. And so getting them together and that sharing then ends up breeding possible synergies, possible ways to help each other.
Absolutely. And then, I take a look at just the strength of the business group too, the benchmarking that they conduct and that they provide. We've been working on something what we call the navigation experience from that consumer aspect. What's the easiest way for people to navigate to all these programs and resources that are available today? And even, them having groups around, okay, so if you guys are worried about the experience, this is absolutely something that the majority of employers are worried about. Yeah. Let's put together a group, align it to the strategy, and see what comes out of it. So as I've always said about Business Group on Health, you don't really have to recreate the wheel, or if you have something that's coming out, you've got a great platform to actually participate and create certain committees that employers are heavily interested in. So I tell my team, like, go to Business Group on Health first. More than likely, they have a resource that's either out there, and if they don't, we know that we can call them and they're ready to listen and ready to help in any way. And it does provide that venue for us.
Of let's not reinvent the wheel. Here's what everyone has put together before, and then maybe GM would build on that or take it in a direction that's custom for your employees.
That is correct. And when I think about Business Group on Health, I mean, there's other associations that we are absolutely very active in. And when I think about the ones that we're active in, it really does align to our strategy and our vision when it comes to healthcare. So if I think about, policy that we talked about a lot, we are very involved, memberships in different organizations that, look at the federal policy as well as local policies that, applying in all these states. So whether that's ERIC, the Corporate Healthcare Coalition, local ones being the Economic Alliance of Michigan, we are actively involved in at the table because as bills start coming down, even if it's at the local level, we're going, okay, guys, if this goes through, how's it going to expand across and maybe become, problematic at the federal level? And then we are very close with Catalyst for Payment Reform as well. Suzanne Del Banco does incredible work, and we are actively involved with them. And I find, again, it's a great forum to learn from one another as employers. So I always say that whatever positively aligns to GM's strategy and really where we feel that we can, participate, engage, and really help change the healthcare industry in a positive manner, that's where we really put our efforts and attention.
Yeah, I mean, I think it's really great leadership that you and others at GM have contributed to this collective effort to make it better for everyone. GM's big enough that you could do a lot on your own, but it helps everyone to sort of share best practices, share data, and sort of lift all boats up.
Yeah, it definitely does, Vic. And I mean, I am an advocate for, even what we do at the large employer level. I don't just take a look at what GM can do and what GM's power is even if we come together with other employers, because, trust me, especially depending on what our strategy is, we're very driven on this value game. And, I have no problem picking up the phone and calling my fellow employers who are also in the game. But I'm very committed to understanding what are some of those outcomes that we're going to see, sharing that broadly with other employer groups, and really helping the people that are not the size of GM, but helping them understand the value there and how they can go after the same thing. And it may not necessarily be a direct contract with the Henry Ford because of the volume, but there's other things that they can do even within a mid to a smaller sized employer. And how do we set the foundation to actually be an enablement for that change to occur?
Excellent. So Sheila, we're 60 days into the COVID-19 crisis, probably 30 days, depending on where you live, 30 to 45 days in the stay-at-home, quarantine, lockdown, variety of different names. It's really, it's unprecedented, of course. It's really scary, and there's a ton of health concern, but there's also becoming, I'm more concerned about the economic pressure and the economic damage that maybe was necessary, but that we're inflicting right now. Talk about that at GM. I mean, I think everyone's following the broad nationwide thing, but you have a ton of employees really around the globe. So in the U.S. and globally, what's it like on the factory floor? What's it like in the showrooms? I mean, I assume you're not selling a lot of cars now. So what does that do to the business? How does GM think about the human impact and the business impact and that tension?
Yeah, first and foremost, Vic, I'm extremely honored and proud of to be an employee of General Motors today. I mean, we have quickly pivoted, and if I think about pivoting, we pivoted very quickly to making face masks and making not only the mask and the gowns and sanitizer.
Yeah,
and
I mean, you literally turn your manufacturing lines to
we did. I mean, we basically, if you think about the ventilators alone, we quickly found a partnership, and also we had to do retooling at our facilities. I would say that GM definitely, in March, it was mid-March, that, we came out and we said that we were going to have basically a stay-at-home protocol. And so I think we came out a little bit earlier than most at that point in time, and I think that was right around March 17th. So the only facilities that we've actually had up since that time are really the facilities that are making the PPE.
Right. Yeah.
So
they have to retasked to help the country in this time of need. Yeah.
Absolutely. So if I think about it, our Arlington, Texas plant, Kokomo, Indiana, also on Davidson Road in Warren, Michigan, we have really, really pivoted to make those things. But it's also given us a really good opportunity to implement what I call some protocol around, the broader return to work. And what's the entry going to look like? What's the testing going to look like? And we don't call it social distancing, we call it physical distancing. And it's really helped because have we had COVID, positive cases? We have. Have we been able to get on those very, very quickly? Look at contact tracing, take a look at, who have they been in contact with? Being able to identify those individuals, quickly test them, get them quarantined at home to make it a safer work environment, we have. And even over the last couple of weeks.
You've been able to meet the country's call for help.
Yes.
And so GM has turned to solve those problems, which is incredible. And it also has been a learning experience for your operation. Like, as we think about moving from 4 or 5 plants doing PPE to opening up the whole operation again, what learnings from those early places about screening and physical distancing and then contact tracing can you then sort of bring to the larger scale rollout whenever it's ready, the larger scale rollout?
Yeah, I think if anything, because we're tracking the data, we're working very closely, even with the state of Michigan, on basically what I call the economic revival to kind of bring everyone back. And that's much broader than just GM. We'll be sharing our data and our findings. So we're very closely tracking everything. You know, we get asked all the time, does the physical distancing work? Does the sanitation work? And even if we think about our return to work protocols, you know, some of the first things that we'll be doing, we will have thermal scanners at the very beginning of our buildings. As you come in, not only will your temperature be scanned, but we've also developed an app, what we call a symptom checker app. And depending on how that app is answered, it's either going to be red or green. If it's green, you're cleared and you're good to go. If it's red, you're going to be diverted basically for PCR testing, and you will be quarantined. We will also be tracking like contact tracing, you know, who have you been exposed to, getting those people off the line and testing for that as well. And quarantining for a 14-day period, testing again before they're able to release and come back to work. I think the other thing that we have also looked at too, which you don't think about these things until you're in the mix of it, but we have a lot of husband and wives that work within our facilities. You know, if one is COVID positive and the other one's coming into work but has no symptoms, not only are you going to have to do the PCR testing, but you're probably going to have to do the antibody testing too, to ensure that one, they've already had it, and are they carrying the antibody for COVID?
Right.
And so all of this protocol, and even from physical distancing, sanitizing, you know, the equipment that's going to be handed out once you get the clearance to go in, from the mask to the gloves, each and every, you know, shift that we work.
Yeah.
And so everything, and I would tell you, you know, and I would say GM's no different. We are definitely making a lot of PPE, but we're donating. You know, we came out first and foremost and we said, and the priority in our mind and everyone's mind is definitely the health system, first responders, and that's where our efforts are going to be put. But, you know, right after that, definitely the return to work protocol. And we have a playbook that is about to be finished on every single avenue that you can possibly imagine around return to work protocol. And for us, I would tell you our goal is really to ensure the safety of our employees. And if I think about safety, not just the physical safety, but the psychological safety that makes them feel safe about returning to the workforce.
Yeah, because it's pretty scary to not know who around you has been exposed, not know what is at risk and what's not. And so those control mechanisms, the temperature screening and PCR testing and then quarantine, I think that actually brings comfort and sort of security to the workforce, where they feel like, okay, I'm going to do my job. And it's almost like a comfortable routine. If it's protected inside this facility, everyone is good, or they've been pulled out if something is going wrong. Something they look like they have symptoms.
Yeah, and in order to make it work, and you know, it's kind of interesting because, you know, if we take a look at some of our facilities, you know, it may be, you know, depending on the facility, it may be, you know, 30% of the workforce being brought back in month one. It could be 50% by month two. So we are doing very much, it will be a staggered approach just to ensure that the safety protocol is working exactly like we want it to.
Right. Yeah. Okay. Excellent. Well, as you know, this series is called The Health Storm. I started it around Thanksgiving, 6 months ago or so, and I was talking about a storm coming in 3 to 5 years and really changing the healthcare system. Um, and you know, I was completely wrong about the timing. The storm seems like it's here right now. But I want to talk to you about the trends that I saw then and get your take on it. So my view is that there were 4 big trends that were beginning to percolate. They were you had to look hard to be focused on them, but they were starting last fall, which are the rise of the consumer. We talked about transparency and getting value. Consumers are trying to take control of their own healthcare, but they don't have the tools they need. They'd like to get tools and rise up. That's one trend. Another is care sort of moving out of the hospital to the neighborhood or the home, and kind of the decomposition of hospital healthcare into more of a distributed model. The second is, third is market entry by non-traditional players. So large tech players or retail players are now, that you wouldn't have thought do healthcare, now are jumping into healthcare. And then the fourth is that technology and data and telemedicine are sort of beginning to be more and more prevalent. Those were the trends that I saw last fall. My assertion, and what I want to get your comment on, is that I think the COVID-19 outbreak is going to accelerate these trends. Like, they always have been there, but there's going to be a catalyst or drive faster adoption of these things. What are your thoughts about that?
Yeah, I think we're going to see, I think we're going to see what I call the new normal, Vic. And if I think about it, what's really interesting, you know, when you talk about, you started doing this and you called it the health storm in November, I can remember working on a project late last year into early this year. And I remember making the statement to an individual who was kind of the project manager. And I said, you know, if I could just get the federal government to kind of enact and remove all barriers to telehealth, I think that would increase our telehealth utilization. And the funny thing is, I get a call from this person, right? Because what does the federal government do? They basically did that.
It all up. The licensure, the reimbursement, everything's open now. Yeah.
Right. Everything's open. So I think what we are going to see, and what we've seen so far, but I think it's absolutely going to stay in play. I think telehealth is here to stay. I think that what we're going to see from systems is that they know that there are some services that they've been able to push out, and can they keep them out in the telehealth environment? However, I think they're going to be looking for a new reimbursement model, right? So what does that look like, and what's the impact to us? Because I think that's number one. I think as consumers, it's going to take us a long time before we feel comfortable going back into a hospital, or going back into a surgical center, or even a provider office. And so, you know, will the electives that have been delayed, will those be brought forward and at the same, you know, what I call volume and quantity as what they were before?
Yeah, I mean,
I think
everyone on my hospital friends are hopeful that all these elective surgeries, of course, are not allowed now, but that they'll immediately flood back in the day they're allowed. I'm not sure that's true. I mean, I think that people are going to be cautious, and if it's elective, maybe I don't need it for 6 months. Let's wait and see. Yeah,
I agree with you, Vic. I think they're going to be very cautious until we get, you know, a COVID vaccine, which probably won't come out until 2021. And I always say, when it does come out, there's going to be priority based on that vaccine, right? Because if there's not enough to go around, it's not going to be everybody gets it, but it's going to be those that are prioritized.
Right.
And so, yeah, I completely agree with you. I think, you know, people that need the hip, and they know they need that hip replacement because they're in dire need, and they were already in dire need, absolutely, they're probably going to want to be brought forth. But if it's, you know what, it doesn't hurt as bad as I thought it did, you're going to delay it as long as you can. And I think that's what we're going to see.
Yeah, and there's a lot of elective orthopedic, but all electives that, you know, I would prefer to be able to move more quickly. It would help me get around. It would help my golf game. It would help me play with the grandkids. But if I'm scared, I may wait for a year. I don't know if I want to do it.
Yeah, I think a lot of it, I think you will absolutely have kind of half and half. Those that are comfortable because they're in so much pain, it'll be also going to want is absolutely, what are you doing to protect me from a safety protocol perspective?
Right.
And I think we will absolutely see those delayed as well. You know, even if I think about, if you think about what health systems have done even during COVID, you've got the telehealth business going on, but you've also had people that still need care. They didn't want to bring them into the facility, so they were sending people out to the homes, and out to the homes at a much, what I call, more rapid pace than what we've ever seen. I think there's a model for that. You know, if they know it works, it's probably here to stay. And again, what's the right reimbursement model for it? So I do think that the new normal is going to look quite different than what it has in the past. I can tell you my biggest concern, and I'm sure it's yours as well. I've taken a look at like the health systems, and I call it feast or famine, even during COVID. Some have just been annihilated with COVID, and they've been so busy that they can't even keep up. And there's other parts of the country that have had to furlough workers because they just don't have enough work coming in. And so what are we going to see from that perspective, and how is that going to change? And I think it's, waiting and seeing. I mean, we are tracking all of our data very closely, what's going on claims, what's going on with COVID patients. Telehealth utilization has skyrocketed, which is great. We love that.
Yeah.
If you take a look at the reasons that it's skyrocketed, for the most part, it's been behavioral health. But that's good. That means people are getting the care they need for the behavioral health needs. And we know it can be delivered in that capacity. So what I've been doing, even with some of our direct relationships, is to go, okay, we need to think about what really can be delivered effectively in a telehealth setting versus a physical office setting, or a physical, what I call surgical perspective, thinking very differently. Even if I need an annual physical, do I have to go see that provider, or can I just go get my lab work done and my diagnostic testing done, and then I'm doing a telehealth visit with the provider itself?
Yeah, I mean, I see my provider who I've gone to for a long time, and we have a clinic session, and it's mostly a chatting session.
Yeah.
He might listen to my lungs or do a couple things, but I'm not sure how impactful that is. And then he sends me to another floor to get labs done. And to your point, like, you could do those asynchronously and not in, one could be telehealth, and I could go to my neighborhood lab and just get the blood drawn.
Absolutely. And, even if you think about it, I think about GM and I go, wow, I'm sitting there with a lot of employees that will eventually be coming back to work. Is there an opportunity to really do some of the diagnostic through kind of a virtual clinic,
Yep.
and get that done with even bringing some docs on site, and then have what you said, the face-to-face or the telephone conversation, so they really understand how you're feeling and what's going on, and are you adhering to the medication and things like that. So
Yep.
yeah, I think the delivery method has to be different than what it's been in the past.
Yeah, so you used a term that I've been using too, the new normal. I think this rolls out in sort of crisis, recovery, and then new normal. So we're in crisis now. Maybe we're beginning to see the light at the end of the tunnel, where maybe the new cases begins to ebb a little bit, and we move into recovery in the next few weeks or month or so. I want to get your perspective of, I mean, no one knows for sure, but what's your view of how long the recovery goes before we get to some semblance of normalcy? So it's a new normal, but we are not recovering anymore.
Yeah, I think it's going to take a while. I think at least the groups that I've been a part of, clinical discussions I've been a part of, and, depending on who you listen to, I think that what we're seeing is really what I call a flattening of the curve. And that's exactly what we wanted, catch supply up with demand, and flatten that curve.
Yeah,
However, I think
get PPE, make sure the hospital capacity can keep up, but the cases
absolutely
didn't disappear, right? There's still going to be
cases.
Yeah, right.
Yeah, absolutely. So I think that what we will probably see is what I call the flattening, but as everything returns back to normal, I think what we're going to see is kind of a spike again and a flattening again. So I think we're going to see this throughout the next year until the vaccine absolutely comes out. So from my perspective, I think that new normal that we just talked about actually doesn't come into play until 2021, where things are stabilized, and then this becomes the new norm. I
Yeah.
think, that the biggest concern that I have, and I'm sure it's one of yours as well, when I think about healthcare, I don't worry so much about the big systems, and I don't, even though they're furloughing workers and things like that, that with federal government funding and things like that, they will be able to stay in business and hum along. I do worry about, the hospital systems that don't have what I call the significant size. I worry about the
The
small
community
providers.
hospitals, the ones in kind of rural America,
Yes,
they have one or two facilities, and they just don't have the depth of kind of reach or the lobbying power or the management team or the balance sheet to really be strong in these situations. But
absolutely.
unfortunately, they employ a ton of people in those
They
communities.
do.
They're probably usually the biggest employer in those communities.
Well, and what you're hoping, I mean, this is my hope. My hope is that the stimulus money that has been rolled out really does go to the ones that need it most. even I think about, the small providers. And I think that one thing that we don't talk about a lot, but I think about the independents, whether
Yeah.
it's an independent healthcare provider or a dentist. I mean, the dentists have been completely impacted through this. And will they be able to stay in business? So I think that when we go to the new normal in 2021, I think the other thing that we're going to have to look at is how many people fell out of the networks. How many healthcare providers do we have still in business? I mean, that's going to be part of the assessment that's going to have to be done. And how is it impacting not just what I call GM employees, but even broader than that? How is it impacting every, American, and how they get coverage, and, what their care looks like in the future?
Yeah, there's no question about that. I'm seeing kind of a consolidation for two reasons. One, that I think there's going to be a need to have at least urgent care and outposts in those communities where maybe the major hospital doesn't survive. But also, when I think about telemedicine and going virtual, you begin to untether the geography of it. So I have a buddy who's a cardiologist here in Nashville, and he is now treating patients around the country because he has friends and patients that are referring into him, and he's not tethered to having to have you see you in the office anymore. And so I think for that reason too, consolidation could sort of build strength and brands, honestly, that are nationwide. Where normally we have, and there's been a few platforms, but they haven't been really a nationwide healthcare platform because it's very localized traditionally.
Yeah, I would agree with that. I mean, if you think about it, it's kind of what you and I just talked about with like diagnostic testing. If you're being seen locally and you think you have a heart condition, the scans can be there locally. And just like your friend who's the cardiologist, he can be doing the assessment, and they don't have to be right there with him. They can be in any place, even in the US or even around the world. And so
Yeah,
I think that's the benefit of
you
what we're
globally.
seeing.
You could have a global.
Absolutely. And I think the other thing that we still have to do, and this again, I think is where we're going to need legislation to quickly kind of come into play. But, you even think about the power of electronic medical records, but making sure that we're on the same platform, that they can be shared across and shared broadly. I think that's absolutely going to, like, that has to be an immediate need.
Yeah. Well,
Because,
whether we're on the same one or not, it has to be portable. Or like I remember the old days of cellular phones, and I was charged more to call my wife than my buddy because we're on different networks. But then that got all sorted out, and now it's just you just call anywhere. I don't even know what network you're on. I just call and it works out. We need that in the electronic medical records too, where we can each choose our own interface, and they have different bells and whistles, but they all have to work together and seamlessly.
It does. And even if you think about it, right, like I know over the last couple of weeks, I've seen a lot of things come out. I think one was a New York Times article, and basically it said, where did the heart attacks go? Right? Because systems haven't been seeing heart attacks.
Yeah, no heart attacks, no strokes, no babies.
No.
Those
and
are
so
really
it's like, where did it go?
Hard to see how that occurs. Yeah.
Yeah. And what worries me, it's like, okay, are we seeing this decline because, people are working remote if they can, they're at home, they're kind of in their own safe space. And are we going to see that escalate tremendously when the work environment opens back up? I don't know, maybe, but it's very interesting to see what I call the significant decline in things that must happen or typically do happen.
Yeah. Yeah, I've been struggling with that. Like, how can heart attacks be impacted by the stay-at-home measures? But the only thing I can come up with is stress. Like, there is fear and anxiety, but there's much less traffic stress, work stress around. And so I that's the only thing I've come up with that could really be an impact. Which is a little
I agree with you.
Society is causing so much stress that many heart attacks happen.
Yeah, it's fascinating. And what I can't wait to see is what do those numbers look like when we do go back to the normal world, right? It'll be interesting because I'm with you. The only thing that makes sense is definitely the stress factor.
Right. Mm-hmm. I want to jump to your thoughts about public health. So public health has been pretty underinvested in the U.S. compared to other countries. And my belief is that it's rising in importance, in public awareness, and that over the next few years, we're going to have significant investment in public health. But what are your thoughts about that?
Yeah, I think we have to, and I think our lesson has definitely been learned from COVID-19. Again, I think what'll be very interesting when everything is over is to really see what vulnerable populations were hit the most. And I think, Vic, we have to really pay attention to the most vulnerable, which tend to be in the public health system. And what do we do for them? You know, if I think about basic needs such as housing, basic needs such as food and the right types of food, the behavioral health component, and even with COVID, I think when we start seeing some of the data come back, because I know I was recently on a call and it was an individual from a health system. It was actually Johns Hopkins, and they've seen a lot of what I call vulnerable patients. And typically they tend to be more COVID positive than the others.
Yeah.
And it makes you wonder if it's because of the environment that they have to live in. So I absolutely do think that COVID-19 is going to bring a whole new light into public health. And I think a whole new focus on public health in general.
Yeah, I completely agree. I think we're going to have to get the data and really study it kind of prospectively. But my kind of gut feeling, which is all it is now, is that where you were from a health position going into COVID-19 really impacted your ability to manage the disease if you got it. So if you had any underlying chronic condition and you were not eating well and you didn't have a safe place to sleep and you were a smoker and you didn't understand how to monitor your health, all of those things that really are public health concerns. And unfortunately, our society has been shown to be not very well prepared. I mean, we don't have, across the population, we don't have good public health.
Yeah, agreed. Yeah. And to your point, I think we're going to see all of that come out in the data, but we're going to really have to put a significant, I think, emphasis on public health in general.
Yeah. Okay, so in my view, I was excited to talk to you because there really are only two buyers of healthcare or funders of healthcare in the U.S. that can kind of align incentives, is how I think about it. So I'm trying to get away from the fights over value and volume because people are so entrenched in those words that I don't find it useful to trigger people that way. So I really think that large employers, you're at one of the largest, but there's several large employers, could align incentives. So I want to talk about aligning incentives. And of course, there'd have to be some discussion about what are the goals, what are our shared goals, which might be the value of healthcare. What are we paying for? What are we getting? What are the goals of this thing? But I find that aligning incentives doesn't trigger people to get mad. It's yeah, we should do that. I think that GM or the federal government, and it's probably both. So the federal government in the Medicare population, maybe Medicaid, is going to push things. But in the younger and more kind of working in the commercial set, large employers are really, I think, most aligned to be able to kind of push health systems to think about things differently. So talk about that. Talk about how GM views that. Is that fair for me to put that on GM? I mean, maybe it's not fair.
Yeah, Vic, I think you raise a valid point. You know, it's kind of interesting. And I think what I noticed years ago, no matter what company I worked for, whenever I would go in and even take a look at the healthcare spend, we had similarities. And whether, you take a look at your top 10 conditions, your top 20 conditions, whatever they are, I would tell you that if I looked at the big players in the game, and I don't care if it's Walmart, Boeing, Intel, whoever it becomes, we are so similar in those top 10 conditions that we kind of go, okay, if we could get our arms around musculoskeletal, what would that do for all of us? If we could get our arms around diabetes, what would that do for us? And so I think we have a lot more commonality than what we think. I think the other thing, what's interesting, and this is just, I call it phone a friend. I love to pick up the phone, and I have colleagues that I call and we bounce things off of all the time in different companies. And I would tell you that we are very aligned, even on common goals. And, even though GM is big, these other companies are big, we're not big in every single state, and we're not. So what I can do in Michigan is going to be very different than what I could do in, South Carolina, right? I mean, there's just no volume, no bandwidth. However, so what I foresee in the future is literally employers coming together to band together on what I call common value goals with common pricing and transparency. And I do think that's the next wave. And because if you think about it, whether you're Walmart, whether you're Amazon, whether you're any of these, we all have that same issue. So unless we really do come together, it's the only way that we're going to really continue driving momentum in the value-based game and really getting the
agree
attention.
with that. I also think that it's my belief that we have 5,000 hospitals in the country, and we really only need 2,500.
Yeah.
And so the large employers, whether you band together or not, you could bring volume. And we just talked about how it's not so much geographically bound, and bring more volume to health systems that are willing to engage over a 3, 5, 8, 20-year time horizon. And that's what I mean, aligned incentives. Like, the health systems need to do well also.
Yeah.
But you need to have better outcomes. And so
we have to.
And GM was really leading this before COVID-19. I want you to talk about what you struck as far as aligning incentives with Henry Ford, because it was really, it's market leading, and I'm not sure everyone knows about it. If you don't live in Detroit, I'm not sure everyone knows about it.
Yeah, it's interesting, Vic, because, again, we have a significant volume of employees right there in Southeast Michigan. And Henry Ford is who we selected to be our partner. And I've got to tell you, it's been a great
And just so people know, how big is Henry Ford? They're a decent sized hospital.
Yeah, so Henry Ford, I would tell you what's interesting is when we looked at our data, majority of our employees were not going into the Henry Ford system, and they weren't. We had them going into other systems. The reason that we selected Henry Ford is honestly because of the quality that they had actually been able to deliver even on the commercial population.
Okay.
And I would tell you that they had been at the value game at that point for about 7 years, and they had tangible data. And the other thing that I would tell you was really important to us, and I think you see it through and through when you start talking to health systems, when you can see that the board of that health system is committed to quality-based outcomes, it flows through the organization, and it does. I talked to so many, and you could tell from the time you talked to the CEO and what their board's mission was, whether they were aligned to value or not. And so Henry Ford was definitely aligned and committed, and still is today. And so I think it's this culture. Henry Ford has not only built a culture across the organization, but down the organization. And then what was really important to us are what I call the 3 E's. I wanted to ensure that we were absolutely improving what I call the member experience, that we were absolutely improving the engagement in the relationship between the physician and the patient. And the third thing was really efficiencies, because I knew if we got the first 2 right, we would get the third one. It's just a natural result. And what we've seen with Henry Ford, and Henry Ford, I would tell you, geographically, we made them meet some very high standards of having specialists in their network, down to peds specialists. And they had to actually go out and contract with other sets of physician groups to make that happen.
Yeah.
And they did.
But that's good. You're forcing them to build out their network and be more holistic and more.
Absolutely. And what we're looking for is a true, what I call clinically integrated network, right? That it's going to be, when we talk about the health of the patient or the health of the member, I don't want to have to go outside of that network to get care. And all my care should be contained and really led by the PCP. I don't want to have 10 different, what I call care management plans. I want to have one comprehensive care management plan that tells me everything I need to focus on, regardless if I have 2, 3, or 5 conditions. And so that's really what we've built. And I've got to tell you, I mean, we are coming up on our second year where we have first, year one results. And we just did a session with Henry Ford, a virtual session through through one of our vendors and Castlight Health. And I would tell you, we are very pleased with what we're seeing. We laid out 19 quality measures based upon what we needed to improve within our employee health. And Henry Ford has done a terrific job in year one. And I've got to tell you, like, we have a 5-year contract with them. It doesn't get easier. It gets much more challenging for Henry Ford to be able to
You're
meet some of those
ratcheting up the
metrics.
hurdles, right? Like they need to continue to make progress and hit new hurdles each year.
Absolutely.
But I want to go back to your 3 E's because I think that's really interesting. The experience, the engagement, and the efficiency. That's very holistic and long-term. Like the
Absolutely.
EM employee must have a good experience. They must feel good. They must feel heard. They must be able to navigate around. They must trust their doctor. Then the engagement, more frequent touch points, more data, more technology, more engagement from both sides, I assume.
Absolutely.
And the last one, efficiency, is what would drive cost. But it's not purely cost. It's cost and health outcomes and quality metrics.
That's correct. Yeah, absolutely. And if you think about like the experience, and I am so committed to driving the experience that literally when I sat down with the Henry Ford team and I was explaining my vision for what the experience looked like, we actually created a concierge model with Henry Ford for those patients that selected that model. And it's very high touch. I said, it doesn't matter if I go somewhere, even outside of the health system, I want to have a VIP service. And that's what I wanted our members to experience. So it's that one place that I can go to for the questions that I have. I don't have a physician. I need one today. What does it look like? And also talking through based upon the kind of the prototypes of the physicians, really understanding what the needs of the member are and aligning them to the recommended physicians. And we actually built that from the ground up. We built very much what I call a robust, clinically integrated model for care coordination. I'm so, and anyone that meets me will tell you this, I am so over the 1990s, what I call care management protocol, because it never worked. And, you'd ask what engagement looks like, and you're like, oh, I called them 3 times and they answered once. That's not engagement, right? And so we built these things really because I had such a fire and a passion. And I think if you've ever seen a family member go through anything, whether it's your child or whether it's your parents or whether it's your siblings, and you've gone through that journey with them and you've seen systems that do it exceptionally well and you've seen systems that are abysmal, I would tell you that's really what lit my fire and my passion around the patient experience and making sure that every day it's flawless. And Henry Ford has been incredible. I mean, if there is a patient issue that comes up, we are on the phone and no exaggeration, within minutes, we're resolving the issue. The physician or whoever heads up that unit is calling the patient, and that's the way it should be. I mean, patients have to wait for testing, I get that, but they should not have to have a poor experience.
Well, and they're doing this at pretty good scale. I mean, like you have a lot of associates going to Henry Ford. So this is not like a concierge where it's only the rich people come and each doc has whatever it is, like 15 patients. This is at pretty good scale.
It is. It's a great scale. And and just the commitment that you see from Henry Ford's leadership to ensuring, I mean, they care so much about the patient. And I think that's what makes all the difference. I mean, some of the stories that I have you're talking the CEO of the Physician Network Group reaching out to patients because they're in need of something. And I mean, they're so committed to just every need that these members have. And that's the way it should be. There are people that really, they have a medical condition, But, and it was kind of interesting, even when I was in Detroit in January, and I had the benefit of seeing a new clinic that Henry Ford had set up. And they said, when I walked in, they said, Sheila, you're about to see your vision come to life. And what I loved is how they thought about the patient. So physically in these rooms, even if I have several conditions and I need to see several providers, the providers are coming to me. I'm never leaving the room to go to a provider. And if I need behavioral health, if there's not an available behavioral health specialist right there on site, there's an incredible, virtual screen that we can bring in the virtual
So
behavioral
like
health
the
visit.
system revolves around the patient. They're at the
It
center.
does.
Everyone is helping the patient navigate their journey, and maybe lots of complications. It could be quite simple, but either way, they're at the center, and Henry Ford's working around them.
Absolutely. And it's kind of interesting, Vic, because, I sit in a remote space, no direct contract, but Boeing, where I sit, actually has a direct contract with one of the health systems that I've had the benefit of going to. And the experience was so incredible that I knew it was what Boeing had put in place, that even Sheila Savageau, as a GM member, really got the Boeing experience, because once you change that health system, they're not going to modify how they do things. They're going to make it consistent across the board for every single member,
Right.
which
So
is exactly what we want.
Henry Ford, they're taking other patients in, but they're delivering that same experience, that same engagement, that same experience.
Absolutely. Yeah. And what's great is, it may be that if an employee doesn't exist at GM, they're not getting that concierge model. But if you think about the clinical piece and things like that, and even the on-site clinic that I talked about with it being centered around the patient, every patient's getting that walks through that door. And that's exactly how healthcare needs to be.
Yeah, and I think it's really, we're in the middle of the COVID-19 thing, but I think examples like GM and Boeing driving change, one, it will just populate naturally because the health systems that are engaged will do that. But two, the other employers that maybe aren't as forward thinking can copy it or copy pieces of it and bring it to bear, and it will lift up the whole country. Over time, it lifts up everyone.
Absolutely, it does. And that's exactly, if I would tell you where my heart is and my strategic vision, it's truly, us taking the leverage that we have along with other employers and really just making it so firm within our healthcare environment that this becomes the norm. And we get to see the, quality delivered. We get to see the right cost delivered. And truly, I always say that, physicians are usually in business because they do care about the patients. I think that what we have come into play is we have a lot of money that comes into play, right? Negotiating the contracts, and you've got the business arm of things, and how do you bring those two things together? And I think that we've been able to effectively bring that together within the Henry Ford relationship, and just being able to talk to each other to really understand, what are some of the limitations and how do we help them overcome some of the hurdles. And they hear our voice and what's important to our members, and we hear them as to what's important to them as a system and what's important to patients in general, and just bringing that together to make the best experience possible.
Yeah. Well, that's wonderful. I'm, we're in scary times, unprecedented times, but I'm also encouraged about the leadership and like how it's working well with Henry Ford and how that can be then kind of populated around the country. So it's exciting.
Absolutely.
Final question for you. I'm asking everyone this. You've been in benefits and trying to move health benefits and healthcare forward for a while, 20 plus years. What do you know now that you wish you knew when you started the game?
I wish that I wouldn't have been so trusting of what I call the middleman. I think that employers, for years, we just sat back and we trusted that everything was being done to benefit
Right.
Our members.
We'll run this RFP for you, and we'll get
Yes.
a lot of creativity, but they don't really spend that much time on it.
Well, I think it's that. And I think even if you take a look at like the carriers, they're negotiating the contracts for you between the physicians, the health systems. I think we all have different stake in the game. And so when I look back, my only regret is that we didn't do this earlier. And I think the reason that we didn't if you take a look at it, and I remember, I started out in the accounting finance world looking at benefits from a very different perspective, very different lens. And I remember thinking one day, it used to be HR people running benefits, and I thought one day it's going to be finance people running benefits because I could just see the escalation trends.
Yeah.
And these are not trends that are just specific to the US. I think the US by far is the most extreme, but we're seeing this in other parts of the world too. And I said, at one point, we're really going to have to get a hold on it. So my only regret is that we didn't start earlier.
Mm-hmm. Yeah. Well, I understand that, and I'm excited that you're in it now. So we're in kind of a wild time, but once we get through this, I think GM and other big employers are going to really lead us to where we're headed next. So thanks for doing this. Really enjoyed it.
Well, Vic, thank you so much. And truly, I mean, I hope to be what I call the beacon of light and the beacon of hope for other employers, and just really changing this industry for better outcomes and better pricing for everyone, because that's what we deserve. We deserve the right model, and we deserve the best treatment that we can possibly have.
No. Great. I completely agree. So thank you, Sheila. I really appreciate you taking time. It's a busy time. Thanks for taking an hour to talk through this stuff with me.
Thank you so much. Have a great day.
Okay, you too. Bye.
Bye-bye.